Welcome to the Bearded Dentist. This is after the root canal. So this patient has side-by-side teeth number 30 and 31 on the lower right side here that has had 2 root canals done. Now, every now and then I'll get patients that'll come in. They'll have a bunch of missing teeth or a bunch of infected root canals or failing root canals, and they'll say, root canals never work on me. Or, I hate root canals, they don't work, or whatever. And oftentimes it's kind of the same picture. And that is, the root canal was done, the root canal looks great, but the patient never went and got the final treatment, which is a permanent buildup in a crown. They think they got the root canal, so the pain is gone, everything's done. And this could be miscommunication from the dentist or the endodontist or whoever did the root canal, and maybe nobody told them, but either way, that's usually the case. And what I want to show with this video is why it's so important to get that temporary material out of there and get a permanent crown and buildup on there. So this is a temporary material, probably IRM, interim restorative material. And this endodontist does a fantastic job. And what he does is puts that little pink stuff in the center of the tooth there is actually a orifice sealer. That orifice sealer does exactly what it sounds like. But above that, he'll put a cotton roll or a little ball of cotton, and above that he'll place that IRM. Now that temporary filling or buildup or whatever you want to call it is really only viable for about a month. After a month, it really starts breaking down and leaking, and even before that, I would say. So it's really important that when you get root canals done, that you go and follow up with your regular dentist, or if your regular dentist did the root canal, which is fine as well, make sure you ask, when am I getting the final restoration, and make sure that they can do it within a month. Sometimes dentists are so booked out that you're pushing that 2 or 3 months later and they can't get to the crown afterwards, and it's really important that that's not the case. Oftentimes also, endodontists or root canal doctors don't remove all of the decay. Now, that's kind of um, a little industry insider issue that some dentists and endodontists will have. My endodontist does a fantastic job at removing all of the associated decay. Associated decay is the cavity that's got to do with why this patient needs a root canal. Sometimes if there's decay on the other side of the tooth or a totally opposite part of the tooth that has nothing to do with the nerve or whatever, it goes missed, and that's okay because I'll remove it and prep it out and do my buildup. But there are endodontists and there are dentists that when they do the root canal, they're just getting in there, removing the nerve and doing the root canal and not removing all of the associated decay. This is not the standard of care. Shouldn't be done that way. Unfortunately, that does happen, but that's another reason that it's super important to follow up with your dentist and make sure that you're getting that final buildup, that final crown done. So what I'm showing here is just me excavating all of that restorative material, that temporary restorative material, out of the orifice, and we need to get every little bit out of there. And there's that cotton roll kind of spinning on my burr. It's very important to get every flake of that stuff out of there, as much as we can possibly get. And it's a very tedious process, and it's kind of hard to do. This patient had 2 very deep cavities in between these teeth, which is very common. And so you'll see the gums are a bit angry there, but we get all that sorted up. And then I take that carbide burr, that slow speed, and with a lot of pressure push down and make sure we're getting all of any softer dentin or inner part of the tooth removed so that we can get a nice clean final product before we place the buildup and crown. This is me trying to show that. I'm a little bit shaky. You can see there's a little flake or 2 in there. Sometimes it's best to try and scrub that out with an acid etch or something else instead of drilling more of the tooth away, and that's what we did. But hey guys, thanks for everything. I appreciate those of you that have liked and followed or subscribed so far. And if you enjoyed the video, please do give me a like and a subscription, and I'll see you at the next one.